We will now address some of the questions that were asked on the topic of OA pain management. Dr. Chappel, there has been confusion recently about whether patients can take 3 grams per day or 4 grams of the acetaminophen per day safely. Can you please address this confusion?
McNeil voluntarily lowered their OTC maximum daily dose recommendations for extra-strength Tylenol to 3 grams per day and for regular-strength Tylenol to 3.25 grams per day, unless otherwise directed by a healthcare professional. This change was designed to lessen the possibility of accidental overdose and encourage the appropriate use of acetaminophen-containing products. If pain or fever persists at the labeled daily dose, healthcare professionals may exercise their discretion and recommend up to 4,000 milligrams per day. Please note that the warning label still says that liver damage may occur if an adult takes more than 4,000 milligrams per day. Dr. Sulich, what are the recognizable signs of liver damage or injury?
Early signs include nausea, vomiting, abdominal pain, and loss of appetite. Keep in mind, prevention is best. Educate your patients not to exceed more than 4 grams per day.
You know, but I've had patients that have actually walked into my office with overt jaundice or mental status changes secondary to hepatic encephalopathy as the first signs of liver damage.
This is why it's important when you're managing patients chronically that they need to be monitored on a regular basis. How can we address patient concerns and misinformation about acetaminophen safety?
We should remind patients to read and follow the medication label. It's very important. Also, we should try to help patients to understand that taking acetaminophen as directed is safe, but exceeding the recommended dose of acetaminophen can cause liver damage. Patients can exceed the recommended dose in a number of different ways. They can take too much of a single product, either by taking the next dose too soon or taking too much medication at once. They can also take multiple acetaminophen-containing products, which can lead them to exceed the recommended daily dose. Recent data suggests that acetaminophen is not effective for the management of OA and back pain. Could you please comment on this data?
The question is referring to the Mercado et al. Systemic review that was published in the BMJ earlier this year. The article had several important caveats, like the inclusion of a small number of studies, making it difficult to draw definitive conclusions about the impact of acetaminophen on either spinal pain or OA-related pain. It is important to remember that acetaminophen is indicated for the management of mild to moderate acute pain. Medications work differently for different people, and it's important to find medication that is safe and effective for your patient, whether that is with acetaminophen, NSAIDs, or other treatment analgesia.
Remember though, trust your experience. What's worked for you in the past and for your patients. Don't change your practice guidelines based on one study or one article.
One of the hallmarks of the Mercado study was that of safety. We saw that acetaminophen was comparable to placebo and there was no increase in serious adverse events. Can you discuss OTC pain medications and cardiovascular risks?
NSAIDs may increase the risk of cardiovascular events in patients with elevated risk. Ibuprofen can interfere with low-dose aspirin heart therapy, decreasing its cardioprotective efficacy. Acetaminophen has not been shown to interfere with aspirin heart therapy and is an effective OTC analgesic option for patients with cardiovascular disease. Can you use acetaminophen as first-line treatment for OA pain?
The American College of Rheumatology lists acetaminophen and NSAIDs among the first-line analgesic options for the management of OA of the hand, knee, and hip. As many OA patients are older adults, it is also pertinent to consult the American Geriatric Society guidelines. These guidelines suggest that healthcare providers should use caution when recommending NSAIDs to elderly patients, including careful consideration of NSAID-associated risks. It is important not to only consider the efficacy of medications when recommending pain management for OA, but also considering the safety. It is important to start with the lowest effective dose of medications and work up from there. If initial treatment regimes are ineffective, this means gradually moving up the pain management ladder and even potentially developing a pain management strategy that involves more than one medication used in concert.
You know, I see quite a few patients in the nursing home environment, and this elderly population has far more risk of chronic kidney disease, cardiovascular risk, and GI bleeding. that's where acetaminophen is a good choice.
And that's why sometimes the comorbidities are going to dictate what first-line therapy you're going to utilize rather than what's perceived the most efficacious.
On behalf of Dr. Sulich and I, we thank you for joining us.